Good evening, everyone. I am Dr. Soumita Mandal, consultant endocrinologist, currently practicing in Kolkata. Today, I'll be discussing about high blood pressure, the medical terminology of which is known as hypertension. Generally, we would all like to have normal blood pressure, right? So, what do we exactly mean by blood pressure? When our heart beats, with each beat, a certain amount of blood is ejected out of the heart into the arteries, which creates a certain amount of pressure against the wall of the arteries, which is known as blood pressure. Or more precisely, systolic blood pressure, which is indicated by the higher reading of a BP value in a doctor's prescription. Now, when the heart is at rest, that means in between two consecutive beats, the pressure generally falls, which is known as diastolic blood pressure, which is indicated by the lower reading of the BP reading in a doctor's prescription. Now, a person's BP can normally rise and fall multiple times over the day. If the person's BP remain persistently high for a long time, then the person is known to be hypertensive or having high blood pressure. So what is the normal value of blood pressure? We generally take 120 millimeter of mercury as systolic BP and 90 millimeter of mercury as diastolic BP for normal values. And if a person's BP rises more than 140 millimeter of mercury as systolic BP, then the patient is known to have hypertension. Or if the patient's diastolic BP rises more than equal to 90 millimeter of mercury, then also the patient is known to have hypertension. A patient is having hypertension, why do we need to worry about it? Well, if hypertension remains untreated, that can lead to serious health hazards like heart failure, kidney failure, heart attack, stroke, and retinal damages of eyes, which can lead to even blindness. So what are the types of hypertension? We generally broadly categorize into two types: primary or essential hypertension, which is the most common type, found in 90% of the individuals, and which is actually triggered by environmental factors and genetic factors. Another category is secondary hypertension, which is usually due to certain diseases like hormonal disorders, like thyroid disorders, or maybe due to diseases of arteries like renal artery stenosis, or maybe due to use of certain medications like over-the-counter painkillers. So, what are the risk factors which pose an individual to develop hypertension in their lifetime? The most important risk factor is age. As we grow older, our arteries stiffen up and causes more resistance to the blood flow, which increases the blood pressure. Second is family history. We often get to see parents with high blood pressure have children who also develop hypertension at a later age. Number 3 is unhealthy or inappropriate diet. That means not taking green leafy vegetables, whole grains, or fruits. Those are rich in potassium, which actually help lowering in blood pressure, and increased consumption of processed food which contain excess salt and fats. Now, what are the symptoms of high blood pressure? One may not experience any symptom at all, but if any symptom is there at all, then it can be in the form of headaches, especially morning headaches, tiredness, neck pain, dizziness, postural dizziness, nausea, vomiting, etc. Now, how can we diagnose blood pressure or hypertension? Well, it is pretty simple. With the help of an instrument, we should simply measure the blood pressure of an individual, which is called sphygmomanometer. It can be either digital or manual. Nowadays, a number of digital manometers are available in the market quite at a reasonable price. Now, the most important question is if we can prevent the development of hypertension or not, or if we can retard the worsening of hypertension. Well, the answer is yes, and it can be done via multiple ways. Number 1 is healthy diet. So we should increase the amount of leafy vegetables, whole grains and fruits, especially the citrus fruits in our diet. Second is we should reduce the consumption of fats, especially the saturated fats like dalda, banaspati, ghee, butter, etc. Limit the consumption of excess salt. Those who are already having hypertension are recommended to reduce their salt intake by 2.3 gram per day, which is roughly 1 level spoonful of salt per day. Now, number 2 is regular exercise. Regular exercise will help you maintain your body weight on the healthier side. In general, one should engage into moderate intensity of aerobic exercise 30 minutes per day or 150 minutes per week. Now, this can be done via aerobic exercises like swimming, jogging or brisk walking, etc. Along with that, a very important factor is management of stress. We should learn the process of relaxation, which can be achieved via regular exercise, yoga and meditation. And last but not the least is adherence to medicines. So one should not forget or stop taking medicines. It can lead to serious health complications like stroke. So please do continue your medicines as per your doctor's prescription. Lastly, I would like to suggest that there is nothing more valuable than a healthy body and mind, and it is very much possible to control high blood pressure with the help of regular exercises, healthy diet and regular intake of medicines. So please follow these rules and stay healthy. Thank you.